Hello, simulation enthusiasts. Today we are going to demonstrate the triage simulation. Let's introduce who we have here today. Everyone will say their names and the roles they will play. So I'll go first. My name is Anthony. I will act as the simulation facilitator. I will control the vital signs as well as be the voice of the patient.
Hey, I'm Logan, and today I'm going to be the team lead.
My name is Vince, and I will be the primary survey.
My name is Mitchell, and I will conduct the secondary survey.
My name is Nathan, and I will be on task.
My name is Jaeger, and I'm going to ensure proper record keeping and be a scribe.
Welcome, everyone. Everyone here is a volunteer with the medical team at the Metal Music Festival. You have access to a crash cart that stocks resuscitation and common medications. 3 patients arrive to the medical site. Please triage them according to the order that you would like to see them, and then get started on the first patient. Patient A is a 60-year-old man. This patient tripped over a rock and fell onto their outstretched hand. The wrist hurts. Temperature 37.4, heart rate 85, respirate 18, blood pressure 135/70, and 98% saturation on room air. We have patient B. She's 37 years old. The patient was wheelchaired in by security. This patient has been drinking alcohol all day and has been nauseous and vomiting, but is no longer currently vomiting. Temperature is 37.3, heart rate 110, respirate 20, blood pressure 110/75, 99% on room air. And finally, we have patient C, 56-year-old man. This patient is also wheelchaired in by security. They're found feeling faint with chest pain. They look pale. 37.6, temperature, heart rate 105, respirate 25, blood pressure 150/97, 88% on room air. Feel free to triage your patients now.
What are you guys thinking? Who's the most concerning here?
I'm really worried about patient C.
Patient B is also kind of concerning.
Yeah, I was thinking patient A is probably like a green because it seems like it's an isolated MSK injury and the vitals are normal. So I'd probably put them last.
Would you like to see patient C first, Logan?
Yeah, I think C would be a red because I know chest pain could have several dangerous diagnoses and they're also satting pretty low at 88, so the ABCs are impaired. So I think CBA would be my preference. What do you guys think?
I agree.
I agree.
Your team has chosen patient C, then patient B, then patient A. Let's go see patient C. So go to slide number 4. This is patient C. Your team enters to see the person.
All right, team, I think we should start with our initial steps. So for our initial impression, what do we see, smell, and hear?
You see a pale appearing man, no odors, and you don't hear any sounds from the person.
Okay, Nathan, could you remind us of those initial vitals?
For sure. I will get a set of vital signs up for you. So the heart rate is 105, the O2 sat is 88, the blood pressure is 150/97, the respirate is 25, and the patient is afebrile.
Awesome, thanks, Nathan. Could you get an IV started?
Yeah, I will get an IV started. The IV is
Okay, perfect. Could we also get the heart monitor, and we'll get nasal prongs set for 5 liters a minute of oxygen, and we'll make a SAC goal of 90%.
nasal prongs are on and the monitor's attached.
Perfect, thanks, Nathan. Vince, could you now lead us through the primary survey and let us know what you find for the ABCs?
Okay, I'll certainly do that. Starting with the A, B, and C's. A is for airway. Is this person talking to me?
Oh yeah, my chest hurts.
Okay, so their airway is clear. B is for breathing. I'm just gonna take a quick look to see if this person is breathing.
Breathing okay. There's no increased work of breathing.
C is for circulation. I'm just going to check the pulse and the cap refill real quick.
Pulse is nice and strong. Cap refill is delayed at 3 seconds.
And I'm just gonna check the patient's skin.
Skin looks pale. It feels warm though.
That completes my primary survey.
Thanks, Vince. I'm thinking we should order some investigations now. So we have a patient with chest pain. So Nathan, can you get an ECG?
Yeah, we'll get an ECG.
Nathan gets you an ECG available on slide number 8.
Okay, looking at the ECG right away, I'm seeing some ST elevation in the anterior leads. So within the context of chest pain, I'm thinking this could be a potential STEMI. What do you guys think?
I agree.
Yeah, I agree.
The ST depression in the inferior leads would also support that.
Mitch, could you call EMS and arrange for transport out of the festival site?
Absolutely. I will let you know when they're on their way.
Thank you. And Nathan, could you get 160 milligrams of ASAPO and also 1 spray of sublingual nitro?
Nitro and ASA on its way.
And then after that's given, let's reassess our vitals.
ASA and nitro have been given. Vital signs are just reloading. The heart rate is 95, oxygen saturation is 95, and blood pressure is 145 on 90.
Thanks, Nathan.
The patient's chest pain feels better now. Thank you for your excellent care. EMS is on the way. However, patient B is now throwing up and they are diabetic. So a medical volunteer comes and asks for help. Please go move on to patient B.
So I think we should start with the same approach here. In terms of our initial steps, what do we see, smell, and hear?
The patient's throwing up. You smell an odor of alcohol and vomit, and the patient is moaning.
Okay, Nathan, could you get some initial vitals and let us know when those are done?
Yes, the heart rate is 110. The O2 saturation is 99. Blood pressure is 110 on 75. Rest rate is 20.
Okay, Nathan, could you get us IV access and also put them on the cardiac monitor?
Yep, IV going in. IV is in.
Perfect. Vince, can you walk us through your primary assessment and your approach to the ABCs?
So my approach to ABCs, A is for airway. So I'm just gonna check, is this person talking to me?
I don't feel so well. Ugh.
The airway looks clear, maybe some potential vomit. B is for breathing. I'm just gonna check for breathing.
They're breathing normally without any increased work of breathing.
And C is for circulation. So I'm gonna check the skin for color condition. And I'm also going to check the carotid pulse. And I'm also going to check the cap refill.
The pulse is nice and strong. The skin is warm. The patient looks a bit pale. The cap refill is 3.5 seconds.
And that completes my primary survey.
Thanks, Vince. So with the slow cap refill, it sounds like they're hypovolemic. Nathan, could you give a 1 liter bolus of normal saline?
1 liter bolus of normal saline going in.
Thanks. And I also think it'd be good to get a glucose, especially because they're diabetic. Nathan, could you do that as well?
Just pricking the skin.
Glucose is 3.1.
Okay, so they are hypoglycemic. Given that they're vomiting, I don't want to give anything orally. So let's give 1 amp of D50 IV. Nathan, can you do that?
Yep, amp of D50.
Perfect. Mitch, can you start us with a secondary assessment?
Absolutely. How are you feeling?
Nauseous, lightheaded, and throwing up.
I'm sorry to hear that. Do you have any allergies?
Nope.
And what medications do you take?
Insulin.
Do you have any medical conditions?
Yes, diabetes.
Okay. And do you know when your last meal was?
Not sure.
And what was going on today? Why do you think you're feeling this way?
Not really sure. I must have had too much to drink today and without much to eat.
Okay. Would it be all right if I examine you?
Sure.
Okay. So I'd like to do a complete examination, including a neurological examination.
So you do your examination. There's poor cap refill, as previously determined, nystagmus, and when you try to get them to stand up, they really can't.
Okay. Now that we've given fluids, glucose, I would like to repeat their vitals.
Vitals are being repeated and they're being updated live.
All right, so just to share my thoughts with the rest of the team, it sounds like the picture here is dehydration, secondary to vomiting, and also hypoglycemia, which has started to improve after we gave D50. So I think if we just continue to give IV fluids for the dehydration, and we can also consider an antiemetic. So Nathan, could you give 4 milligrams of IV ondansetron?
Milligrams of IV and ondansetron going in.
The patient is rehydrated now and they feel better and they are looking forward to going home.
Another life saved.
Life saved.
The friend comes and picks them up. Another life saved. I just have an alert from a medical team volunteer that's standing by patient C. Patient C with the STEMI is having some chest pain again. So let's go see them first.
All right, let's reassess here. So in terms of our initial impression, what do we see, smell, and hear?
The person is just moaning in pain, no odors, and they're grasping their chest.
Okay, Nathan, could you repeat the vitals and let us know what you find?
For sure. I will get another set. The patient's heart rate is now 100, still satting 95%. Blood pressure is elevated 150 on 92, and the rest rate is 22.
Jaeger, were you able to chart those vitals?
Yes, I got them down.
Thanks. And Mitch, I think you called EMS last time. Is that right? They on their way?
Yes, I did call them and they're en route.
Perfect. While we're waiting, Vince, can you run us through another primary survey?
Yes, absolutely. So looking at the airway again, is this patient able to talk to me?
Yeah, they're just moaning and complaining of pain.
Okay, and just looking to see if they're breathing. Does it look like they're breathing?
They're breathing. There's no increased work of breathing.
And looking at C for circulation, I'm going to check the pulse again, check the skin color condition, and for cap refill again.
Cap refill is about 2.5 seconds. It looks like normal skin color, normal skin temperature.
Okay, thank you.
Thanks, Vince. So it sounds like we're still dealing with a STEMI here. And so we'll wait for EMS to come. In the meantime, to deal with the recurrent chest pain, I'm thinking we could potentially give a second dose of nitro. Jaeger, do you remember when the last dose was?
Yep, the last dose was at 1922, so 8 minutes ago.
Thanks, Jaeger. Nathan, can you give a second spray of sublingual nitro?
I will give a second dose of nitro.
The second spray is in. The patient feels better. EMS has arrived and takes the patient to the hospital. Another life saved.
Great work, team.
Now, patient A wants something for pain. Please see patient A.
So we'll begin with our initial impression. What do we see, smell, and hear?
You see swelling of the right wrist, no odors, and the patient is complaining of pain.
Okay, Nathan, can you get us some initial vitals and report back to us?
I will do that. The heart rate is 85, O2 sat is 98%, blood pressure is 135 on 70, and rest rate is 18.
Thanks, Nathan. Jaeger, were you able to chart that down?
Yep, I've got it down.
Perfect. And Vince, could you walk us through the primary assessment again?
Yep, absolutely. A is for airway. So is this patient able to talk to me?
Yep, it hurts. My wrist hurts.
Okay, so the airway seems clear. B is for breathing. Does this person look like they're in any difficulty breathing?
No difficulty breathing.
And C is for circulation. So I'm going to check pulse on the distal radius, check their skin, and also make sure that there's no signs of any deadly bleeding.
Normal radial pulse. The skin looks well perfused. There's no signs of bleeding.
That completes my primary survey.
Thanks, Vince. So it doesn't sound like we have any concerns with the ABCs. I think we can move on to a secondary assessment. Are you able to do that, Mitch?
Absolutely. Hello, sir.
Hello.
I will now proceed with sample history. Can you tell me what's going on?
My wrist just really hurts. My right one.
Oh, okay. I'm sorry to hear that. A few more questions. Do you have any allergies?
Nope,
And do you take any medications?
I do not.
And have you ever been diagnosed with any medical conditions?
Nope.
Okay. When was the last time you had something to eat?
About half an hour ago, I had some fish tacos.
Okay. And do you remember the events leading up to this pain that you're experiencing?
I was just dancing and I must have tripped and landed on my right wrist.
Oh, okay. That sounds concerning. Would it be okay if I examine you?
Mm-hmm.
All right. I'm going to do a complete examination of the wrist in addition to the joints above and below.
Sounds good. So you examine the wrist and the right distal radius area is tender with some edema. The joint above and below, so your fingers and elbow are all normal.
Okay. Well, now that some time has passed, I think we should repeat the vitals.
They're unchanged.
All right.
Thanks, Mitch. Given your exam, it sounds like we're concerned about an injury to the right wrist, potentially a fracture. In the meantime, I think our immediate management is going to be just rice. So rest, immobilize, cold, elevate. Nathan, could you go grab us some ice?
We'll grab some ice.
And I think we should also consider analgesia for the pain. So Nathan, could you give 1,000 milligrams of acetaminophen and 400 milligrams of ibuprofen PO?
400 milligrams of ibuprofen given and 1,000 of Tylenol.
Perfect. Were you able to scribe that down in terms of our treatment, Jaeger?
Yep, I've got it down. Thank you.
Awesome. Thanks. And then I also think we need to arrange for transport since we don't have x-rays on site here at the festival. Mitch, could you call for transport or arrange for some sort
Absolutely.
of transport?
Yeah, I'll ask the patient if he has a family or friend that is able to come and pick him up and bring him to hospital or somewhere where he can get that x-ray done.
Yeah, my friend is at the concert here with me, so I just need to give him a call on the cell phone.
Okay, excellent. Let me know when he's on his way.
Sounds good. So the friend comes and transports the patient out to get an x-ray. Another life saved. So congratulations, team. You saved all 3 patients.
Yay.
All hands in. Another life saved.